So, hello and welcome to the PT's PT podcast. I am your host, Dr. Sean Lorden, and today I've got with me Dr. Stefanie DePaul. She is the owner of Boston Health and Wellness Physical Therapy in Stoneham, Mass, and a fellow Northeastern grad like myself. And just wanted to introduce you, and you can go ahead and introduce yourself and tell us a little bit about you and your
Hey, thanks,
background.
Sean. I appreciate it. Happy to be here. Excited to be on your podcast. Yes, Sean and I went to PT school together at Northeastern University in Boston. And yeah, I'm here today to have a conversation with Sean and hopefully inspire other PTs.
Just why don't you give our audience like a little background on you, Steph, and tell us like what kind of settings you worked on and worked in, and why you chose to become a PT.
Sure. Yeah. So, I guess when I was younger, I was a gymnast my whole life. And with a gymnastics background, you see a lot of injuries around you in the gym. So that sort of inspired me to want to learn more about how to help other people fix their injuries. And then when I was 13, I had my tonsils out. And I decided I wanted to be an ears, nose, and throat doctor because my surgeon saved my throat and saved my life. So that's sort of how I started down this medical field. I went to UMass Amherst for my undergrad. I was pre-med bio, and then I realized I didn't really like bio. So I switched to exercise science, kinesiology. And then I graduated and realized, what do you do with a bachelor's degree in kinesiology? So I decided to go the PT route. So I applied to Northeastern. I got in for the post-baccalaureate PT program, and that's where I met Sean. We became friends, and 4 more years or 3.5 more years at Northeastern. And yeah, finished with a doctorate degree in 2012. So yes, so then became a PT. And now I have my own practice. So, but there was quite a journey to get there.
Yeah, I mean, so why don't you tell the audience a little bit about your steps? So you just graduated. What you do? Like, what was your career trajectory?
Yeah, sure. So obviously, when you become a PT, everybody envisions like, I'm going to work with athletes and I'm going to, be the best PT in the world. Of course, we all are, right? I mean, we went to school for like anywhere from 6.5 to 8 years to get this doctorate degree. And, we all want to do our best and be our best. So I started my career working at a larger company. It was a chain. There were, I believe, 20 locations in Massachusetts. And I worked for somebody else to start. I think that's the best way to start your career is learning from others and working from other people. So I started my first couple years working at this office in the financial district in Boston. I was the clinic director immediately. So that was kind of crazy right out of PT school. I wish I had a little more mentorship in the beginning instead of being put right in charge of a clinic. But I figured it out. I learned from my peers. I learned what worked and what didn't work and things I liked and things I didn't like. And then I sort of created my own unique treatment style. And so that was great to start. And then I went to a different office, worked for somebody else in the North End for a little while, realized I didn't want to stay there forever. And then I decided, I think I can do my own thing. I started a concierge PT practice, ironically, concierge. And I called it Boston Health and Wellness. I didn't know what to call it. And I said, I wonder if this name is available. It was. And I started just doing in-home treatments at people's homes, out of pocket only, while working for somebody else. I believe Sean and I have a similar path here with this story. And then eventually I said, you know what? I'm sick of driving to people's houses and sitting in traffic. And, I'd rather just have a brick and mortar and have everyone come to me and be able to see more than one patient at the same time. Maybe I can start taking insurance. So I started a practice with a business partner, Didn't go awesome. So I learned a lot from that experience. And then I said, you know what, I can do this myself now. Like, I don't need a business partner. I'm going to do this all by myself. And I started my location in Stoneham, Boston Health and Wellness, and I own it 100%, and it is all mine, and it's going very well.
Awesome. It's a great
Yeah.
synopsis. Um, I do want it to remind me to dig into the business partner thing a little bit because that intrigues me.
Sure.
So as we get through this, I just want to kind of go back to that. But
Sure.
can you just tell our audience like a little bit about the mentorship that you had, coming through PT, becoming a PT?
Yeah, I mean, so I get this question a lot, Sean, these days from my new grads. They at their interview, they'll usually say like, "How much mentorship will I get here?" And I think we do a really good job at my office to provide mentorship to the new grads. I believe you do too. I think that's a big part of becoming a PT and starting your career. Me personally, I didn't get a ton in the beginning, but I had to like look for it and I had to find my own mentorship and I did. Um, but yeah, it wasn't really given to me pretty readily. Like, I guess it's different these days, right? So back when we graduated, I don't want to date us, but 12 years ago, um, it wasn't as big of a topic. But so I didn't get a ton in the beginning, but along the way I did find it. And continuing ed, learning from my peers. I had a boss that worked with some of the professional sports teams in Boston. I learned from him. But yeah, I think also my other um, disciplines. I'm a yoga instructor, so I pull from yoga with my PT practice. I'm a personal trainer, so I pull from that. I'm a running coach, so I pull from that. And I think all of those things make me a better clinician.
Yeah, I mean, I think that's awesome to kind of bring up too, is that it's not just, there's so many different like kind of health options that you have as a PT to add to your practice. And, I think, when you talk about the mentorship program, we've, structured one out for new grads, but kind of everybody hits at a different place, right? And I think that's where, we've struggled in the past is, somebody with 3 years of experience versus, a brand new grad each probably need a little mentorship, right? So what does that look like in each scenario? And that's why when I interview PTs, I always say, you'll get out of your mentorship program or out of your profession, you know, A, what you put into it, and B, what you're looking for, right? So it's like if you're looking to be a better, exercise prescriber, why not take some courses on, or read the exercise science, that CSCS book, right? You don't even have to sit
Yeah.
for the letters, but like go through the book and work with a study buddy and learn some of those principles. And so that sort of feeds me into the next question because I think Con Ed and mentorship really go hand in hand. So tell me about your theory on like when a new grad PT should start continuing education and what that looks like for you at Boston Health and Wellness.
Yeah, I mean, the sooner the better. Obviously, PT school is great. We have a great education, especially at Northeastern and any PT program in Massachusetts, really. Um, but the sooner the better. I have two clinical students at my office right now, and both of them are already pelvic floor certified, and they haven't even graduated from PT school yet. So I think the sooner the better. It makes you a better clinician, but I think a lot of the kids these days are coming out with dry needling certifications and pelvic floor certifications even before they graduate. I think it just makes you more hireable. I think it makes employers more desired to have you on their staff because most of my PTs that I employ currently, almost all of them are pelvic floor certified, and almost all of them are dry needling certified. So I think the sooner the better. And if you want to, work specifically with runners, having a lot of running continuing ed, obviously we learn in school about injuries that are common for runners, but taking the courses that are specific to the population you want to focus on as early as possible would be my best advice.
Yeah, I think now is a good time to mention that you've been quite the accomplished marathon runner.
Yeah, yeah. Yes, that was my hobby for a very long time. I still love running. I enjoy running. I ran 15 marathons worldwide, including the big six, which are the six world marathon majors, which include Boston, New York, Chicago, London, Berlin, and Tokyo, Japan. Um, and there's a rumor that they might be adding a seventh major in Sydney, Australia. And if that's the case, I guess I'm going to have to lace up and head to Australia and get that seventh star. But yes, I have completed the 6 stars, which is sort of one of my accomplishments. And I do specialize in treating runners because I am a runner myself.
That's awesome. I love that. So you
Yeah.
heard it first. So if you're a runner and you live in the Boston area, you got to see Stefanie up in Stoneham. Um, what advice would you tell your younger self, Steph?
Yeah, I mean, this is a great question. You know, I would tell myself to learn from your own mistakes, right? So it's okay to make a mistake. When you're young and you make a mistake, you sort of freak out and, oh my God, right? But, looking back now at some of my mistakes, I learned so much from them, and I probably wouldn't be where I am today. So you need to make the mistakes, especially early in your career. That's the best time to when you're a student, when you're learning, when that first couple years of being a PT, you need to explore. But you also need to learn from the mistake and correct it, right? So that's the big part. I feel like I'm the person I am today because in the beginning there was a lot of uncertainty in certain places. Um, but I wouldn't be who I am today without those early mistakes that I made and that I've learned from and overcome. And yeah, it's okay to make a mistake. That would definitely be the best advice to my younger self because I didn't feel that way before.
Yeah, I mean, so now, the question has to be, what's one mistake that you can like really kind of pinpoint,
Ooh.
professionally, and what was it, and what did you learn from it?
Yeah. Well, I guess, well, professionally, one of my biggest mistakes was having a business partner when opening my first practice. That's probably the biggest mistake I made professionally.
Mhm.
Um, I just didn't want to take the risk. I didn't want to go in 100% on anything, right? So if you only go in 50%, if it doesn't work out, you only lose half, right? But it probably will work out. So like you need to really like invest in yourself, trust yourself, put 100% in because you'll get 100% out. So my biggest mistake to answer your question was probably not fully believing in myself and thinking I needed a 50% business partner for a practice that actually didn't do as well because of the 50% business partner when I could have just done this myself from the beginning, 100%. So yeah, you just need to like trust yourself and invest in yourself.
Yeah, and I'm sure everything happens for a reason too. And I think that there are things I'm sure you learned from that venture that have made Boston Health and Wellness even more successful today. Because of that experience. Uh,
Absolutely. Yeah.
what do you love most about being a physical therapist?
Oh, there are so many things, Sean. Where do I start? Well, the first thing I love about being a physical therapist is I actually get to spend time with my patients. Some healthcare providers, if I became that ears, nose, and throat surgeon that I wanted to be when I was 13, I'd be zipping in and out of rooms in 5 to 10 minutes doing follow-ups, and I'd be in surgery all day. It'd be a totally different lifestyle. I'd be on call, I'd miss my kids' birthday parties, right? So being a physical therapist, you get to spend an hour with your patients. You get to be home with your family at night. You really get to know your patients. You really get to be a good mom. Like the work-life balance is awesome. You have set hours, you go in and you come home at a set hour. I love that. I love that there's stability in our career. I love that there's room for growth in our career. I love that you can open your own practice and like own it yourself. Like, I can't believe we did this, Sean. Like it's amazing. And just 12 years ago, we were sitting in a classroom together, and now look at us today. So it's really, PT is an awesome career. Definitely, definitely love being a PT.
If you were to go back to 2012
Hmm.
and redo your career given the knowledge that you have today, if any, what would you change, if anything?
Would I change my career or my career path?
Your path as a PT.
Hmm. Uh, uh, I would work for somebody else first for probably 5 years, and then I would have probably started my own practice 100% immediately. Because the whole song and dance of working for someone else and then working for someone else and then trying with a business part, like there was just a lot of like starts and stops and starts and stops. And I just feel like you should learn from other people. Like you probably shouldn't open your own business right away. I mean, maybe, but you should try to learn from others and see how other people do it first, and then sort of take from that what works and like learn what doesn't work and try not to make those mistakes yourself. Learn from other people's mistakes and then and after those 5 years, get at it. I wish I started this sooner. I don't want to say how old I am, but I wish I started this probably 5 years out of school. Would have been more ideal instead of 9 years out of school, I guess 9 and 8.5.
Yeah, I mean, I still think you're doing a great job. So, don't beat yourself up about the timing.
Thanks.
I think the timing happens when it's ready, when you're ready for that time for that to work. And, I think there are, you know, from my personal experience, there are pros and cons to starting, earlier and later, and I think, um, if anybody has questions, about this podcast, I'm going to link Stephanie's information and, my information is obviously on the podcast. So if you have specific questions around that or, opening your own practice, feel free to reach out to us. But yeah, there's a lot of steps and I totally agree with you, Steph. It's so important to, I call it like learning on somebody else's dime, right? Like that's
So
really
that's
important too.
right. Yeah.
Learn I personally worked in almost every setting and, but specifically in orthopedics, not only did I learn how to become a great PT, at the first place that I worked, but I learned, what great things they did business wise and some things that I wanted to change and things that I didn't necessarily agree with. And, that's kind of shaped, the way the concierge does business. And our field has changed and I think there is, back to the mentorship track, there's a lot more push toward that
Mhm.
right out of school. And I think with the COVID education, I think it's even more important that, as outpatient companies, we invest in a solid mentor track because we just need to meet the students where they are, and a lot of this hybrid education has kind of been hit or miss for some schools. And that's, you have to understand it is what it is. It's hard to, you know, to teach somebody in a hybrid scenario when we work in a hands-on field.
Correct. Yeah, I've had a lot of students come in and say, "Oh, well, I had to take, musculoskeletal 2 lab online because it was COVID. So I never actually did the joint mobs on anyone." And
Yeah.
they come in and I'm like, "What? You've never actually done that on any." So yeah, that is a great point that you bring up, Sean. Some of these new grads or clinical students that we're getting have never even worked on a patient because they were doing
Yeah.
lab from their room on their computer.
Yeah.
Yeah.
So it's just, I just, I feel as though there's a need in the field to meet the students where they are. And, especially, for like this generation, like the next year or two of students, especially is going to, need probably a little bit more, just structured programming. And, I think that that's something that as, for us, at least, we're really working on trying to standardize. And I'm sure you guys are too. And it's great that you have two clinical students. I love that. That's awesome. Um,
Yeah, we love our students.
what's next for Dr. DePaul?
Oh, as far as what?
Your career.
Oh, sure. Well, currently I am pelvic floor certified. I'm also dry needling certified. I'm a yoga teacher, so I'm a registered yoga teacher. I have my CSCS, which is my certified strength and conditioning specialist. Or I am one of those. Yeah, so I have a bunch of letters after my name. People like to call it my alphabet soup. Which is great, but I'd like to also get a specialty in women's health. I believe Sarah, who works for you, she actually has that specialty. I'm pelvic floor certified level 1, so I'd like to go for pelvic floor level 2. So those are next on the docket for my continuing ed. Always looking to grow and learn and improve. You should never stop learning. You have to continue to stay current and yeah, I just want to continue to do more. So that's probably next. As far as owning a business, we have grown significantly in the last 3.5 years. So I started Boston Health and Wellness in Stoneham. November 1st, 2020 was our opening day. And so we're about 3.5 years in almost, 3 and a little bit. So, and now there are 8 physical therapists working for me and 2 PTAs. There's 2 therapy dogs on site, which is nice. We have our PT puppies that are there. And then we have a bunch of aides. We have some massage therapists. We have a yoga instructor. So the staff has grown significantly since November 1st, 2020, when it was just me, like saying, I'm the front desk and I'm the therapist. And I just brought my dog to work, so I wasn't alone. And that was sort of how the office started. And now there's about 22 of us on my wall, I think. And not everyone's full time, but people do like one yoga class a week or they work per diem one day a week. But yeah, we've grown pretty significantly as an office and as a staff. We have a new website that's launching today, which is so exciting. It's going live as we
Congratulations.
speak. Thank you. Yeah, check it out. The website, bostonhealthwellness.com. It looks great. And we are doing an office expansion project also as we speak. So we had this like old garage that was attached to our office. And when you pulled the door up, it was this huge garage. And so I brought in a general contractor and he said, oh, yeah, I can finish that space for you. And so this like unused giant space we had attached to our office is now being finished and it should be complete by tonight, I think. So
Nice.
we're gonna have a whole nother area of the office, and then we just added a whole nother private room too, since our women's health population and our pelvic floor population is exploded in the last couple of years. So yeah, there's a lot happening for me.
I love that. That's so exciting, and just a testament to your hard work and dedication to, not only meeting your patients where they are, but to grow in the field, and offering opportunities to other therapists in the area. That's awesome. That's really cool.
Yeah,
Proud
there's
of
a
you.
lot going on. Plus, I have 2 under 2 and a stepson, so I'm a busy mom with 3 boys and 2 boy
Yeah,
dogs and a boy husband. So I've got that going on at home too.
yeah. So for everybody who's not watching, on video, she's got a cape on her back. She's Superwoman. So
Ah,
where she's doing a great job.
thanks, Sean.
Having 2 little kids at home too, 2 little girls, it's definitely, it changes the way that you view your life priorities, and it's amazing that you've been able to grow the business and be able to be a good mom too at the same time. It's not easy. Um,
Thanks, Mom. Right back at you, Sean.
yeah. So in closing tradition, I kind of do like a firing of little questions. I
Ooh,
gave you a little heads up on them, but favorite
ooh.
concert.
Oh, definitely Lady Gaga at Fenway Park.
Nice.
Yeah.
Best meal you've ever had, and who did you share it with?
The best meal I've ever had was definitely in Tokyo, Japan, when I was running my marathon. Right in front of Mount Fuji, there's this hotel called Ubuya, Ubuya. Look it up, but there's a room there that looks from your hot tub at Mount Fuji, and the hot tub is being heated by the volcano. Like it's kind of amazing how that all happens. But there's a restaurant in it with like the most amazing sushi and wagyu beef that you cook literally at your table yourself. It was delicious. One of the best meals ever. That's probably the best meal.
That's awesome. I love that.
Mm.
What does it mean to you to be a great PT?
Oh, wow. To be a great PT, it's really connecting with your patients, I think. You don't want to just treat someone's knee or someone's shoulder, you want to actually get to know the patient and connect with them and build a rapport and build trust. I think that's so important because it's so much more than treating your knee, right? I know all my patients' husbands' names, their dogs' names, their kids' names. I know about their life. I care about their goals, and I care, why am I treating your knee? Like, what do you need to get back to in your daily lifestyle? And I think that is the most important piece. Like, you need to understand your patient's wants, needs, and goals and really connect with them and get to know them on a personal level.
Yeah, I love that. I couldn't agree more, because I always say, especially with the newer grad, it's like, you know, it's okay to not be perfect or know exactly what you're doing every time, but it's not okay to not ask the questions and connect with your patients so that they want to come back and see you, right? Like that's the biggest thing. It's like, you know, is it a place where they want to spend time and they're willing to work through to a solution to their problem with you? Or is it sort of like he doesn't really listen to me, or he doesn't seem engaged? You have to be engaged. So I love that.
Definitely.
Mantra for your life, or a
Oh
quote that
yeah.
you live by.
Yeah. Get up before everyone else and go to bed before everyone else, and you will have the most successful day.
I love that. Brooke would love that. I don't
Yeah.
know. Brooke will be watching this and she'll love that because
Good.
she's always
Yeah.
up
Very
earlier
good.
with the girls. Um,
Wonderful. Yeah. Tell her I
so
said
now
hi.
I have to ask, what time do you guys go to sleep at night? Or what time do you go to sleep?
7:45. 7:45. 8, like
Right,
8 on a late night.
right with the kids.
Oh yeah. Like
Yeah,
don't they say you have to sleep when the baby sleeps? Like that's literally an expression. So like I do. No, I don't take naps. Like I don't sleep when they sleep during the day, but at night I sleep when the babies sleep. Oh yeah.
yeah.
7:45 or 8 is bedtime, and then I get up at 3:45 or 4 every day.
Wow, that's early. Love that.
I know. So if you're ever up that early, send me a text. I'll be up.
Awesome. All right. Well, Dr. Stefanie DePaul joined us here on the PT's PT podcast. Thanks again, Steph, for taking the time today. And looking forward to having you on the other podcast too, Hooked on Health, to talk all things women's health. So thanks again,
Yay.
Steph. Appreciate
Super
it.
excited. Thank you, Sean. I had a great time.
Awesome. Thank you.